Hello everyone, this is Udit Mishra. Presently I am pursuing my BTech degree in Computer Science and Engineering in KIIT University, Bhubaneswar. In context with the competition organized by MHRD Ministry, that is Samadhan, we three students, that is me, Udit Mishra, Vineet Kumar Gupta and Vedant Shrotria, along with our mentors, Dr. Siddharth Routray and Dr. Manjusha Pandey, are here to propose an ideation that is minimizing the number of COVID testing kits by proper classification of health. As we know, the testing kits for corona is costing approx 4,500 to 5,000 rupees each. And due to the fear of this virus, extensive amount of tests are being done, most which gives negative result. This shows how a considerable amount of tests are being used because of fear of disease spread. Most of these kits could have been saved or been used for further positive results. If we see the data, in every 100 tests done, India has got 2 positive tests. This tells that in a final data set, if we look on 11th April 2020, it shows that only 4.7 were found COVID-19 positive. This means 95.3% were negative. This is a very good result in point of medical issues. But for economically, it tells that how much money is being wasted over such tests. So our aim is to reduce the number of tests being performed by using intelligence essential without leaving any positive case behind. Reducing unnecessary use of test kits will greatly lower the economic burden, and the saved kit can be used in more serious conditions. So how do we achieve this? We can use reinforcement machine learning classification model that will work on the dataset of COVID-19 tested. In the dataset, the parameters would be all essential contents of all immune system, that is protein, different vitamins, human health index, and many more, which will result into a certain pattern being found in corona positive patients. Through this approach, we can accurately predict the chance of person being COVID-19 positive. After this, if the prediction results shows a higher chance of infection, a test can be conducted using that test kit. And if the prediction shows negative result, then up to the doctor, the test can be done accordingly. So, using all the analytics, we will be able to increase the probability of selection of patients which may likely be infected, and still doctor can also go beyond this for checking other patients too. In this way, the patient who are likely to be infected will be tested only. As a result, there will be a less economic burden due to the high cost of imported COVID-19 test kits. Thank you for watching. Jai Hind.